666-555. And the ADT says ADT pulse. Kind of a pain in the ass to find it.
And then
You can also go online. It's on right here.
Alright, going live on your TikTok, Dr. J. Live on BAM. Welcome. If you guys are just joining us right now, we are in San Antonio, Texas with Dr. Jeneby and Dr. Phillips. They are currently doing some 360 liposuction along with a breast reduction. And we'll be doing a tummy tuck as well. If you guys have any questions, feel free to ask them in the comments below and we'll do our best to answer them for you. If you guys fill out the Get a Quote during the live, you can receive 24% off on your procedure with us, but you can only get that offer if you fill it out during the live. Thank you for the gift, Kathy. Thank you for the follow on Dr. Bam's TikTok, Lisa. So beauty, what they do is when they do everything on the back first. So what we did earlier today, they did the Lipo 360 and the Renuvion on the back. Then the team comes in to help flip her. They infiltrate and start going in and doing the liposuction and reduction and tummy tuck on the front. Thank you, Kathy. You have a great day as well. Sin, thank you for the follow on Dr. Bam's TikTok. Hi, Pam. I'm sorry that you broke your wrist and rib, Kathy. Good luck with your appointment today. Hello, Pamela, all the way from East Tennessee. Thank you for joining us today. Gary, thank you for the follow. Melissa, thank you for the follow on Dr. Geneby's. And thank you for the follow on Dr. Bam's TikTok. Thank you for the follow, Mona. Pamela, Dr. Phillips and Dr. Jeneby are doing a Lipo 360 right now on the front side and a breast reduction, and we'll be doing a tummy tuck as well. Welcome, Dan. Actually, that depends on your surgeon and if you've asked for that. Welcome, Pam from Missouri. Pamela, if you're interested in scheduling a consultation with one of our surgeons here, you can click that Get a Quote down in the bottom left-hand corner to schedule your consultation. And it can with the tummy tuck because they are cutting out a little bit of skin and then pulling it up and sewing it together. No problem, Pamela. Just let me know when you've sent it in, and I'll make sure someone from our team gets right on it to schedule that consultation for you, because we can probably get you in today for an online consultation. LP Lewis, I can't show the full surgery on TikTok, but I can show it on YouTube, which we are live on YouTube right now. So if you want to head on over to our YouTube channel, that link's going to be in our bio in the link tree. Ashley, if you're wanting to know about pricing, I can't discuss pricing on our lives, but you can fill out the Get a Quote and speak with someone from our financing team, and also have them schedule a consultation with you, so you can find out more information about that. Hello, Lynn from Virginia. Thank you for the follow. Good morning, Joe. Momo, we're excited to see you. And over the next couple of months, coming in for a surgery with Dr. J. Rosie, for the mommy makeover, it all really depends on what all surgeries are included. Usually it's lipo, BBL, breast reduction or augmentation, tummy tuck. I would say maybe 5-6 hours. It just really depends on the surgeon and how many procedures you're getting done. Barbara, thank you for the follow. Terry, right now, Dr. Phillips and Dr. Jeneby are doing a lipo 360, breast reduction, and also tummy tuck. Tamara, yes. Dr. Jeneby usually has surgery at least one every day of the week. It all really depends on the time of year. Some months are busier than others. Thank you for the follow, Rhonda. Thank you for the follow, Pauline. Yes. Right now, Dr. Phillips is doing the liposuction. So going in, they've already broken up the fat a little bit, and now they're going in and sucking it out. Richard, I can't discuss pricing for the surgeries and stuff on our lives, but if you're interested in getting a surgery done, you can press that Get a Quote button down in the bottom left-hand corner. Fill that out, and someone from our team can get in contact with you to discuss financing and also schedule a consultation for you.
Yeah, 0.5.
Yes, we try to go live as often as possible, just as a way to help inform you guys, answer questions when we can. discuss that, Barb, but to my knowledge, no.
Right over back. Maybe on. Almost 650. For what? That was left breast. Lipo.
The IV is just IV fluid. The patient is under general anesthesia, so just making sure she's staying hydrated.
We didn't do any work here. We're taking it out.
Yep, and we have the anesthesia doctor right behind the patient, so we've got 2 doctors working on the patient today doing the surgery, and then 1 anesthesiologist. And then we also have an additional assistant with the surgery as well. Sonobello is like a big corporate. This one I would say is more like a private practice, but that's owned and run by Dr. Jeneby, and then he has a couple other doctors that are a part of his team as well. Stephanie, Dr. Phillips and Dr. Jeneby are doing some lipo 360, a breast reduction, and a tummy tuck.
Oh yeah.
Terry, I don't believe that the procedure is necessarily different, besides that it's just different doctors. They're both plastic surgeons. We're in Maximus Surgery Center here in San Antonio, Texas.
Line 5, we're going to be on left side.
Teresa, no, we are in San Antonio, Texas, so not too far from you if you're over in Houston. Betty, if you want to have your husband get in contact with us and see if we can help kind of clean up that surgery if he feels like they messed him up, you can go ahead and do that by scheduling either with the get a quote button that's down in the live, or you can go to the link as well in our bio. Queen of Bling, this is not Sonabel. This is Maximus Surgery Center with Dr. Phillips and Dr. Jeneby. Jen, they are finishing up with a breast reduction right now, and then continuing with lipo and a tummy tuck. No worries.
Not that in-store, the real
Yes, sir.
We're almost ready for you for.
Yes, sir. You need another stapler, honey? You got it. Oh, I love it.
Yes, Kelly, if you had a major weight loss, we do have all of our surgeons can do the skin removal for you. If you want to set up a consultation, we can probably get you in today. Just fill out that get a quote. That's going to be in the bottom left-hand corner. Jen, all of our doctors here at our surgery center practice as much safety as possible and have plenty of protocols if anything does happen. And that's why we, like, for example, if there's able to be 2 surgeons in the room, they usually also have an assistant. And then we also have the anesthesiologist in the room the whole time the patient is under as well.
Well, for me, 35. 33.5 you probably can be or
And ask them what they need.
well, come back in here with Mackenzie on your phone.
Oh, okay, I got it. Here, hold on.
Get her number.
I think I do.
Come back in here and we'll talk.
Spicy red. Give me 1 second and I will ask. Same with Polk, I will ask your question as well.
We'll be setting up the lunch there.
Okay.
She didn't answer, Doctor. Let me go talk to Dr. Pat.
Ask Dr. Cash.
Hold on, here she is. Here she is. Let me put her on speaker. Can you mute?
Come near me. I can mute. Yeah, what's up again?
Sorry about that, guys. Had to pause it really quick.
Okay, which means that you're up there. Ball bunion on down there.
Alrighty. Dr. Jeneby, I have a couple questions from our TikTok. One of them is, how long do you have to wait until you can sit after a BBL?
And the answer to that is?
2 weeks. Okay, 2 weeks for that. Plus, Dr. J always has you purchase the BBL pillow as well.
Big, label, weird-looking avocado chair. And green, like an avocado. I'm like, what are you fucking, you're sitting on avocados? And it's asked my face, and they're like, yeah. It looks like a big inflatable chair. Sorry. Oh.
And spicy red, that also means that you won't want to sleep on your back either. You'll want to sleep on your side or your stomach for those 2 weeks. No worry, Red. Rita, we are in Maximus Surgery Center in San Antonio, Texas. And Red, if you're interested in scheduling a consultation with Dr. Phillips, you can click that Get a Quote down in the bottom left-hand corner, and we might be able to get you in today for the consultation. If not, definitely a little later this week, or whenever your earliest convenience is. You're welcome, Rita. Melissa, thank you for the follow over on Dr. J's TikTok. Lola, Dr. Phillips and Dr. Jeneby are both working on a breast reduction, a little bit of lipo 360, and then also tummy tuck. Alrighty guys, give me a second. I'm gonna switch around so you guys can get a little bit of better view at least of the doctors. Give me 1 second. Grace, thank you for the follow on Dr. Bam's TikTok. Oh, Crystal, we're so happy that you came and had your surgery done with Dr. Phillips. Yes, we love him. He's really, really good. I love when him and Dr. J also tag team on surgeries together. They do a really great job together working, and also it just really helps the patient out too, because it helps. Yes, Lola. If the doctors are able to, they will go in and do surgeries together. That way the patient is under the general anesthesia for a little less time. And also just so there's more eyes on the patient while working. Congratulations, Stacy, on your surgery. Yeah, it's nice when the doctors are able to work together for sure. Then they are doing a breast reduction, lipo 360, and a tummy tuck. Michelle, thank you for the follow over on Dr. Genevive's TikTok. We really appreciate it. And then for my YouTube people, you can kind of see where they're starting to work on cutting back the skin for the tummy tuck. Grace, it all depends on what surgery you're getting. So for example, if you do like one surgery, depending on what it is, it could be about a month. Or if you're getting like a mommy makeover, it could be, you know, like 3 or 4 months. Because you're getting most people when they do the mommy makeovers, it's a BBL, liposuction, breast reduction or breast augmentation, tummy tucks. So it just really depends on the surgery. And when you come in for your consultations, the doctors can help give you a better idea of what your recovery time will be. Stacey, I'm glad that you're feeling good today. I hope that your recovery continues to go really well. Lipo 360 and a tummy tuck. So the Lipo 360 would be front and back, plus the tummy tuck in the front. So with it being about a month, but it also depends on the person too. And also keep in mind with the surgeries and stuff, with the stitches and everything, you won't want to do any heavy lifting or any kind of crazy activity as well. So like say you work from home, you could get back to work a little bit sooner, depending on what the surgery is, because you can be a little bit more relaxed at home compared to like when you're in an office having to get in and out of the car, driving to and from the office. If you're on your feet all day, that might be a little bit harder. But once again, the doctors can help give you a little bit of a better idea of what your recovery time will be for the surgery, because it also depends on how extreme the tummy tuck or the lipo might be. Yes, exactly, Stacey. It all depends on the individual. It also depends on how well you are taking care of yourself post-surgery. Because if you don't follow the post-surgery guidelines for how to clean, you know, not lifting anything, stuff like that, it can take you longer to heal. And that's why they have those guidelines for you to follow. Steph, if you mean like doing, like you want to have the lift and implants lower on your chest, or like when they originally do it, it starts off low. Because from what I've seen, they will do it up higher, and then over time, usually within the first year, they will all start to settle more into place. And once again, it all depends on how well you're taking care of yourself post-op too. User on Dr. Geneby's TikTok. We are located in San Antonio, Texas. Steph, from what I've seen with our doctors here, that's rare for them to have the serious drop over time. But you also have to think, you know, maybe in 10 years after the surgery, because your muscles and your skin kind of loosen up and stuff like that after having the surgery, because it's not going to be as tight from when you first got it. It'll drop a little bit, but you can also always come back in and have them readjusted too, but it's rare. No worries, Steph. Angie, thank you for the follow over on Dr. Geneby's TikTok. We appreciate it. And for everyone over on Dr. Bam's TikTok, we really appreciate the questions. If you're just joining us, we are, Dr. Jeneby and Dr. Phillips are doing a breast reduction and liposuction and a tummy tuck. Tomorrow, yes, they're using staples on the breast, but let me ask, I think I know how they're using them, but let me double check. Dr. J, we have a question over on our YouTube channel. For the staples on the breast, what are those used for besides holding it in place? Like, are you using it to make the incisions where to stitch and lift the breast?
So they're tailor tacking staples, so now you can see they're gone. So it's just so we can apply
Yeah.
to mimic a surgery. Can we use those, we mark them where they are, and then we take them out so we know where to cut. Because you can always cut more, but it's hard to add back on if you cut too much.
Yeah.
So we use that as the estimate.
The old adage, measure twice, cut once.
Mm-hmm. And that's why you do it before she sits up in the bed as well.
And we could keep stapling if we want to take more. It's like playing first. Or I can continue. consultation before committing.
Justin, can you look at my phone? Sitting on TV?
Jennifer, thank you for the follow over on Dr. Genevieve TikTok.
Hey.
So tomorrow, if you couldn't really hear, if you could or couldn't hear them, I'll just repeat it one more time. They use the staples as a way to mark where they want to make the incisions and start removing all that extra skin and stitching up and making the stitches where they need to be made in order to have that lift on the breast. Because it's easier for them to staple it, put it in place, sit the patient up so they can see how it's going to sit, than to keep cutting and then accidentally cut and then cut away too much. So this is like so they have a better idea. Stacey, thank you for the follow on Dr. Phillips TikTok. We appreciate it. Anthony, they are doing a breast reduction, some lipo, and a tummy tuck right now. Miranda, thank you for the follow over on Dr. Genevieve's TikTok. We really appreciate it. No worries, Anthony. Megan, thank you for the follow over on Dr. Genevieve's TikTok. Dr. Genevieve, Lizette is asking, is it possible to have a mommy makeover if you have Hashimoto's or yes, or PCOS?
Yeah, we have a lot of picos, we have a lot of Hashimoto's, kind of big
Hashimoto's is just a thyroid condition
Autoimmune.
that needs to be managed by endocrinologist.
Okay, doctor, ready to...
Miranda, congratulations on your 100 pounds that you've lost. That's awesome. If you are interested in getting a procedure done with Dr. Jeneby or one of the doctors here at our surgery center, we do have financing options, so that can help you with the pricing a little bit. So if you're interested in scheduling a consultation, so you can find out more about the surgery and pricing and everything, go ahead and fill out that get a quote down in the bottom left hand corner. So D, if you want to have your tattoo removed at our spa called Spa Black, which is just across the street from our surgery center, they do laser tattoo removal. Stacey, no, I did not see your question. I saw that you followed and I saw that you asked, but I have not seen your question yet. Lupe, we are in San Antonio, Texas.
Now this one.
Okay, we'll call her.
Let me run across the gas.
What do you think?
Yeah, I'll be back.
Hey, I didn't have to,
That's that lady who's peppering you.
a little bit up.
So Tiffany, I can't discuss pricing on our lives,
I didn't have to do anything.
but if you're interested in scheduling a consultation with one of the doctors, so we can figure out pricing and everything,
Thank you. Keep going, keep going, keep going. You're good. You're good.
you can fill out that get a quote in the bottom corner, left hand corner, and we can schedule a consultation for you and have someone from our finance team get in contact with you about financing options. Miranda, okay, so you're in Florida, so you're not terribly far away from Texas. We do have people fly in from out of state to get surgeries done with Dr. Jeneby and a couple of our other doctors as well. So that's not a big deal. Unfortunately, we do not take insurance for any of the surgeries because they are cosmetic. But that's why we have the financing. Yeah. But that is why we have the financing options. It depends on the tattoo. So think if the tattoo's all black, That'll take a little bit longer for it to completely fade away. Also keep in mind that you'll still have a little bit of a scar from where the tattoo was because of that scar tissue. But Dee, if you want to check out Spa Black here in San Antonio, I would go ahead and give them a call. And I believe Dr. Evans, she's one of the providers at our spa. She's been doing some of the tattoo removals at the spa recently. So if you want, you can schedule to see her. But any of the providers are really good too. Correct. I cannot show the patient or the full surgery on our TikTok, Instagram, or Facebook. But if the patient does consent, I can show the full surgery on our YouTube.
Yeah, I want to make sure your placation's done, but it's just the muscle for you.
We also won't film if the patient is 100% uncomfortable. So this patient did consent, so we're good.
No Shigamedex, ever.
Jill,
Let that shit wear out, man.
Dr. Jeneby is doing a breast reduction, lipo 360, and a tummy tuck right now. I know, I'm trying to keep up with the comments too. There's a lot coming in, which I really appreciate. I really appreciate everyone being very involved in asking questions. I do my best to make sure that if I can answer them, I will. Or if I feel like it's a good time to ask the doctors, I will. It's kind of up to my judgment for that, for when to ask the doctors. Leah, we are in San Antonio, Texas, in the Stone Oak area. Okay, Tiffany, let me double check and I will look for it and I'll make sure our team sees it. I'll send it over to them and make sure someone gets in contact with you here shortly. Tiffany, what is your question? We will do our best to answer it. Hi, Joanna. Joanne, for something like this, at least 2 months, if not longer, because of the amount of surgeries that she's gotten done today. Mary Lou, congratulations on having your surgery with us very shortly. I'm gonna say no, Tiffany. No clips should be left in after surgery. Johanna, we are located in San Antonio, Texas.
Hey, Mark, can you call Justin back here? Justin Marburger. like dress like your room free.
All right, Tiffany, I just saw your get a quote paperwork.
Just until he comes back. So why don't you come on this side?
D, yes, you can get a BBL and have your breast implants removed and replaced at the same time. Once it, just keep in mind that when you're recovering, if that's if you're getting both of those surgeries done at the same time, you'll have to sleep on your side. Johanna, I can't discuss pricing on our lives, and we do have team members that speak Spanish as well. So if you want to fill out that get a quote, let them know what surgeries you want to get, and also in the information ask to speak with someone who speaks Spanish. Yes, they can do the reconstruction after the mastectomy. They won't perform the mastectomy, but they can add in the implants after that procedure has been done. They are doing breast reduction, tummy tuck, and lipo.
Hey, can you do me a favor?
Tiffany, we are located in San Antonio, Texas.
That top one, yeah. Blink on again. Yeah, that's better. You want that on 70? Hold on, keep for a second. Yeah, 70. We just turned it on.
Okay.
You guys can keep going. And then this will be 70. Thank you, Robert. You're welcome. All right, 75.
Oh yeah, Tiffany, not too far. And we do have the option for some of our packages where we can put you up in a hotel room after your surgery. You'll be transferred from our surgery center to a nearby hotel, and there will be an overnight nurse there to help take care of you. Dr. Jeneby, just letting you know I'm at my 15-minute mark.
Okay. Why don't you go ahead and tell everybody that you'll see them later and do the 30 seconds so they can get their 20 to 40% off.
Okay. All right, guys. So I unfortunately have to leave to go do work with another provider. So the lives will be over for today. But thank you guys so much for coming in and watching and asking all of your questions. Really appreciate it. I want to give you guys 20 seconds left to take that chance to fill out the get a quote So you can receive that 24 to 40% off on your procedures with us. So I'm going to count down from 20, fill out that get a quote. That way we can help with financing and scheduling that consultation for you guys. So 20, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Thank you so much, guys, and we'll see you later.